A very warm welcome to Physio TV viewers. Today we have a very special speaker who is also our alumni, Dr. Kiran Shanbhogue. So she will be speaking on the topic all on embracing humility, the vital role of I don't know in physiotherapy practice. As we all know that this title seems to be really something which is very interesting. So we are really looking forward to this session. But before we begin this session, I would like to introduce Dr. Kiran Shanbhogue. She has completed her UG from Sancheti Institute College of Physiotherapy. She has done her master's from KJ Somaiya College of Physiotherapy. She's also a certified pelvic floor rehabilitation specialist and also has completed basic yoga training course from the Yoga Institute at Mumbai. She's also founder of Physio Kiran, an online platform to discuss anything and everything related to community physiotherapy. So we welcome you, Physio Kiran. So the stage is yours. Kindly begin with your interesting session on embracing humility.
Thank you, ma'am. So I would like to first, hi, my name is Kiran, and I'm so glad to be back on this platform again. So I would like to first start by sharing my slide. The topic for today is embracing humility, the importance of saying I don't know in physiotherapy practice. Before I start, I'll tell you how I came up with this topic. So, hi, I'm Kiran, and I just completed my master's and I started working as a clinical physiotherapist. And this is going to be a very simple talk, no technical terms, wherein I'll be describing how to be an expert at a particular topic. But I want to share my journey as what are the challenges I face as a clinical physiotherapist. So after I finished my graduation, and I think that is something everyone faces, is whenever we see a new patient, we are at our utmost focus that we have to find the correct diagnosis, the correct treatment, whatever is the recent advances. We need to be able to provide the absolute best care to our patients, which is not wrong, and which is the case in most of the patients that we see. Most of the patients, about 90% of the cases that we see, are something that we've learned, we are aware about, and we are skilled at giving the appropriate treatment. But sometimes there are some cases, some patients come up with some symptoms or some complaints, which are something new for us, or something that we have not heard at all, and something we have not read at all in any of the textbooks in all the years of our practice or all the years of our study. So that is when this uncertainty in the diagnosis is what happens. And that is when I, as a clinical physiotherapist, I started facing this anxiety that, oh, this is something I don't know. How will I be able to help this patient? What will I do about it? And that is when I faced the challenge of, I struggled with this challenge of saying, I don't know how to go about it, what to do next. And I felt as if I'm failing as a clinician to provide the best care to my client or to my patient. So this topic came to me because one of my patients in the clinic, recently she had come with the complaints of very severe headache, neck pain, and dizziness, and she has been going through this entire experience for over a year. She had visited many doctors in the past 1 year, ranging from MBBS doctors, ENTs to Ayurvedic doctors, and even many other physios before. But somehow the diagnosis was not being concluded, or she was not getting the right treatment, and she was suffering throughout the 1 year's time. And finally, she had come to our OPD, and we were asked to check. So I, for once, for the start, I was taken aback that, okay, so many tests have already been done. All the other people or other distinguished people have already checked her, but still there is no, there's nothing that has been helping her. So how can I help her? So in the first few sessions, we were just trying to understand the condition. So her symptoms were very vague. There was pain and neck dizziness throughout the day. Nothing was relieving the pain, nothing was relieving the distress. So this was the first time I attempted to tell her I don't know. The first two sessions, whatever knowledge I had about such conditions, I told her. I tried to do those assessments, but then I somehow was at I reached a limitation that I did not know what to do. So I told her I don't know, but I also told her that I'll find out what is the matter with her. So this is something I did. So and it made it this was the first time she felt that okay, fine, there is someone who's actually there to listen to me and find out what is wrong with me. And I told her that even though I don't know right now, but I'll make sure that I find out what is wrong with you, and whatever is in my capacity, I will try my best to help you out. So that was like an ice breaking session wherein she started building her faith in me, and there was a rapport that was built between me and her. And with that rapport built, what helped me was that the whole process became a team effort. So she started giving me information which she did not share it with the other professionals, wherein she mentioned that she had infection and all of other things. So uh, this faith that was developed helped us gain more information about what was bothering her, and this helped me make a more definitive approach to finding out what the probable diagnosis could be. So I asked her, and then I told her that I'll go back, I'll read up. I did read up, and then the whole process became very easy. So how to say I don't know without compromising your position as an expert? First thing is to identify the reason. Okay. So the reason can be one, either lack of knowledge, which means that there is information out there, but you're not aware of it because you've not come across it. And second is uncertainty, wherein you've done all the exhaustive diagnosis and assessment that probably could have been done, but still there is no conclusive diagnosis that can happen. So the first thing is to identify the reason. Second thing is to stay calm. So when I was put in such a situation where I was unaware of what was going on, I was calm and I told her that I upfrontly, honestly told her that this is the situation. So the level of confidence and faith that she had in me helped me find the probable causes and helped me take those efforts to find out what could have been wrong. The third step is to find the answer. So how can you find the answer? One is you can consult your seniors or you can consult your peers. You can do research. Now, research doesn't mean that you have to always refer to research articles. That is the best source of information. But then you can talk to other experts via the various social media platform that is available. So there are many other experts using Instagram or LinkedIn where you can connect with them and discuss a certain case if you know that those are the experts in that particular field. Or you can find blogs written by different physiotherapists, credible physiotherapists, and see how they approached a similar case, basically a case study. And you can always, if not, then you can involve a team of members. So not just you, but you can involve the physician or you can involve the ENT in this case to find out what is exactly wrong. So these are the different ways you can find the answer. The most important one is avoiding blame. So this is a thing that most of the patients dealing with chronic conditions face. So sometimes even after going through so many doctors and doing so many tests, and if the diagnosis is not conclusive, uh, the physicians are tempted to say that, oh, it's just in your mind, or it is a psychosomatic condition. And then that becomes very difficult and distressing for the patient because whatever symptoms or whatever complaints they are facing is very real for them. So if we as medical professionals dismiss those symptoms or don't acknowledge them, then it becomes very difficult and it creates a lot of anxiety and other mental health issues in those patients. So avoiding blame or blaming the patient or the client is important. Then you can do referral. So if you understand that you have done everything possibly you could in your scope of treatment, meaning assessment and diagnosis and treatment in physiotherapy scope, then you can always refer the patient to other departments wherein they can get checked by other healthcare professionals to rule out other possible diagnosis to that particular condition. And lastly, but the most important one is reassuring action. So this is something that helped me as well. So when I was interviewing the patient, taking the history and all, and when I told her that I don't know what's going on, what I did was whatever questions she had, I started making a note of those questions. Why this helped me was one, I did not forget those questions, and two, the patient was assured that okay, whatever questions I'm asking the therapist, she'll make sure that she finds out. Also, when I was referring her to another specialist, these questions helped me identify the information and then share it accordingly. Then after that, I gave the patient a timeline wherein I told her that, okay, within 24 hours or within 2 days, I'll come back with you and I'll tell you what is something that I found out. And in the meantime, whatever information I had or whatever provisional diagnosis or provisional information I had regarding her case, I told that I feel based on whatever information you've given me, this could be the problem. But to find out if this is the perfect diagnosis or not, we need to do certain things, and for which I will follow up with you within 1 or 2 days. So then the reassuring actions cemented the fact that, oh, okay, now I am in the same team as she is in, and we are going to work this out together. We are going to find out what is happening to me. So this was important, and that is how the case went about. Now, regarding the case, so we found out what the diagnosis was, and it was not just me; it was a team effort. So I and my sir and all of us, we figured out what the probable diagnosis was. The patient also was a part of the team. She helped us figure out which symptoms she could relate to and which not, and then she started off with the treatment. So now I would like to share what are the benefits of acknowledging what you don't know. First thing is, there's this thing called as Dunning-Kruger effect. So what it basically means is, if you are a fresher or you've just graduated or you've just come out of something that you are learning, you are at the peak of confidence and you feel that, oh, I know everything about the subject. This any patient who walks into the clinic, I will be able to provide the best possible care, which is a good approach. But what we realize is that as we go ahead and as we go ahead in our professional journey, there are many cases wherein we are not able to understand what is wrong with the patient. And what we thought was the information we had, we realized that, oh, there is so much more to it. And then there comes something called as valley of despair, where we think, oh, I, I don't think I'm a good doctor because I don't know what to do. There are so many things wrong, and whatever I learned, it's not applicable now. What to do? And then the first step, which is I don't know where we start from there, we go about finding answers. We put on our detective hats. We try to find out what could be the probable reasons. Where am I limited? What other sources of information I can use to find out what is wrong with my patient? And then there comes a slope of enlightenment and plateau of sustainability. So the more we learn, the more we realize how little we know. If you've asked any expert who is specialized in a particular field, or for example, in our case, specialized in a particular joint, you will realize that what they felt that they knew when they just graduated versus what they know now, they realize that, oh, there's so much more to just this one particular joint. So it's the same thing that the more we learn, the more we realize how little we know. And that's a good thing, so that this gives us a scope to expand as a professional. Another benefit is, instead of having a fixed mindset, we start having a growth mindset. Now, so there's a difference between a fixed mindset. The person with fixed mindset, their approach towards every new challenge is that, oh, I need to win at this challenge. I need to make the best out of this challenge. I have to have a positive outcome. And when they face a setback, the result or what they feel is, oh, I'm a failure. I'm not able to understand. I have wasted all my years. I don't know what to do. Whereas when a person with growth mindset sees a challenge, the the thought process there is that, oh, what can I learn from this? What is something new that I'm going to gain out of this? And if they come with a setback, or if they come up with a situation where they're not able to understand what is going on, instead of frowning and thinking that, oh, I don't know anything, they'll find out solutions. They will do whatever possible in their capacity to find out solutions. So in that process, not only do they learn, but they learn and they repeat the same thing every time they face a challenge. So they're not only able to help that one person or one patient in our case, any other similar patient who comes henceforth, they will have a similar approach and they'll be able to reach out to more people and help more people. So another benefit of acknowledging that what we don't know is called as cognitive reshaping. So when you see as a failure as a failure, there is no growth or development. But when you and that leads to a lot of anxiety and stress. But when you see failure as a learning opportunity, it not only improves your the knowledge, it helps improve your ability to face challenges, and it also helps improve emotional intelligence. The studies have shown that people who have this kind of mindset are able to produce better results as compared to ones who have a fixed mindset or who see failure as failure and don't try to learn something out of it. And last and most important is humility. So when you acknowledge that you don't know something, you are humble and you are open, you set aside your ego and you're open to accept help from not only just people who are equally qualified, but also from other people who you think might not be equal. Like for in my case, the patient's relative told me that, oh, there was an infection and she did not continue the course of medicine. That could have probably been the cause. So setting aside the ego helped me realize that, oh, this could have been one of the reasons why she's experiencing a dizziness. So that was also figured out. So, and humility is a very important aspect of your personality because that helps to create stronger relationships and it builds stronger foundation towards success. And when you practice humility, doctor and patients become a team. So you work as a team, find out what is wrong with the patient, and you work together to find the solution. And the compliance of these patients to your treatment because of the faith that they have in you increases. So the results automatically increase. So I would like to say that yes, it's not just saying I don't know, but I don't know and I'll find out it should be the approach. Thank you.
Thank you, Physio Kiran, for this wonderful, enlightening session. I would want to know that who has been your role model to actually follow this and in reality, in real life? Are they
So
your patients, your teachers, your parents?
like when I was in Sancheti in KNH, and I used to like, especially in Kamala Nehru Hospital, when there used to, we were the only ones in internship that we had to see those patients,
Right.
and there were many times as interns that we did not know what to do, and all the teachers there were always there to tell us that okay, this is something you don't know. Maybe you go read back. We used to never be given answers essay, but we were meant to go back and read, and that really helped me. Like this habit of going back and reading has really helped me because if there's a person with neck pain, I don't always see that, oh, okay, these are the set of exercises that I actually go through the whole process of history taking, assessment, and then whatever exercises are suitable for that patient, you give those. So that really, really helped me. And it like we were given the freedom to acknowledge that, okay, if you don't know, that's fine, but you need to find out how to go. So that really helped me.
Wonderful. So you owe it to your teachers. Great. Okay, so I guess with this talk, our young viewers and our Physio TV viewers are actually going to ensure that if they don't know, that's also okay. And I think the motto should be is to have a pathway to how to gain more knowledge and in the right direction, and also to embrace humility, as you rightly said. So with this, we would end this talk, and I would like to thank Dr. Kiran Shanbhogue for giving your time and sharing this wonderful talk with all our viewers. I would like to thank the team of Physio TV, Dr. Mudita, Dr. Amruta, Dr. Venu Mohan sir, and uh, and we meet next for the next Physio TV session soon. Thank you so much.